Welcome to today's Medicare 360 show. I'm your host, Jennifer Lee, and today we are going to deep dive on the Medicare New Handbook. We're almost done, and I will go over the new updates for Medicare and New Handbook 2026. So let's get started. We are at page 122 of the Medicare New Handbook for 2025. So let's get to it. Premium, the periodic payment to Medicare, an insurance company or healthcare plan for health or prescription drug coverage. So keep in mind your Medicare Part B premiums are going to be sent to Social Security. If you do have any premiums to your insurance company, it could either be sent to them, mailed to them, auto deduct, or sometimes you could auto deduct from Social Security as well. Preventive services, healthcare to prevent illnesses, to detect illness at an early stage when treatment is likely to work best. For example, preventive services include pap tests, flu shots, and screening mammograms. Definitely, preventive services is good to do, and typically they're at zero cost because, of course, we want you to be healthy and see any red flags or just take precautions in your health. Primary care doctor, the doctor you go to first for the most health problems. They may talk with other doctors and healthcare providers about your care and refer you to them. So remember, usually in a HMO plan, you will have to see your primary care physician to get a referral from your doctor. So keep in mind when that happens, typically, depending on the medical group, they could have that on file for the whole year. So you don't have to worry about going to your doctor. They could get that approval for several weeks, months, or the whole year. Referral, a written order from your primary care doctor for you to visit a specialist or get certain medical services. Without a referral, your plan may not pay for services from a specialist. So keep that in mind. Sometimes you routinely see your specialist, you think it's already approved or authorized by your doctor, and if it wasn't, you may be liable or at cost for those services. So just make sure it has been approved and so forth. Just make sure you're not paying out of your pocket on that. So keep that in mind. Service area, an area you must live in for the plan to accept you as a member. For plans that limit which doctors and hospitals you may use, it's also generally the area where you could get routine non-emergency services. Plans can, and in some cases must, disenroll you if you move outside their service area. So keep in mind in most Medicare Advantage plans, well, all, and your drug plan, it is based on county and zip code. Sometimes it's based on zip code because you might be living in a different county and so forth. And even for a Medicare supplemental plan, it is based on zip code. But if you do move, sometimes you could still keep your plan. Skilled nursing facility, a nursing facility with the staff and equipment to give skilled nursing care and, in most cases, skilled rehabilitative services and other related health services. Skilled nursing facility, sometimes if you are at the hospital, you can't quite go home, you could get a referral to go to a skilled nursing facility for more care like rehab before, so you could get well before you go home. Skilled nursing facility care. So, skilled nursing care and therapy services provided on a daily basis in a skilled nursing facility. Examples of skilled nursing facility care include physical therapy or intravenous injections that can only be given by a physical therapist or a registered nurse. Okay, we are on page 123, some non-discrimination notice. I won't go through that. You could just read that yourself. Accessible communications, information on that. If you do want Medicare New Handbook in other languages, you could definitely call for that as well. So, guys, we are done, right? So this is awesome. We finished the Medicare New Handbook just in time for the new 2026 Medicare updates that I would love to go over with you guys so you are well informed. So let us get to that. Okay. Let us see. Just one second. Okay, I know we've been going through the Medicare New Handbook this whole year, but the Medicare and New Handbook for 2026 just came out. This is what it looks like. If you are new to Medicare, you probably want to read this, or if not, just listen to this radio show and we cover most or all of this, right? So you should have already got your official guide from CMS mailed to you, all Medicare households, every fall. Okay, so it does include your summary of benefits, your rights, your protections, and your options. So the biggest thing I would say is the Part D as well. That was a big thing last year, the prescription drug changes. So the out-of-pocket cap for prescription drugs under Part D is increasing from around 2025 to 2100 in 2026. The maximum deductible for Part D plans will go up to $615 for 2026. I would say keep in mind the formularies do change, the tier levels change, the amount that you're paying, and the deductibles may change. So definitely look at that because you do not want to be surprised with a larger cost to your drugs. Insulin cost cap does remain in place. No more than $35 per month, no deductible for the insulin, which is great. Adult vaccines, those recommended by ACIP, continue to be covered under Part D with no cost sharing. That is also good. Medicare Advantage and supplemental benefits. So, changes in what special supplement benefits for the chronically ill SSBCI may include non health related items being narrowed. The focus is more on benefits that directly improve or maintain health function. Some plans, Medicare Advantage or standalone Part D, may no longer be offered in certain areas. Beneficiaries should check whether their plans are continuing. So this is definitely a big thing. I highly recommend you look at your mail, right? Open your mail because there are changes. Cost and premium changes. So Part B premium is projected, okay, this is a projection, this is not set in stone, to increase to something like maybe $206.50 per month in 2026. Deductibles for Part B are also rising. More to come on that once it comes out. IRMA, income related monthly adjustment amount, surcharges for higher income beneficiaries will also increase. So keep that in mind as well. So there are new and enhanced benefits, digital tools, and preventive care. So there are more tools for managing Medicare benefits online, managing your prescriptions, viewing Medicare summary notice, MSNs, getting the handbook digitally. So remember, there is the ANOC, which is the annual notice of changes that you should get with your plan, if it's a Medicare Advantage or a drug plan, that tells you the differences from 2025 to 2026. Okay. Expanding preventive services, for example, updates in cancer screenings, possibly expanded coverage for colorectal screening via newer methods. So, what are your enrollment periods, rights, and protection? So, a reminder, annual open enrollment for Medicare, include Medicare Advantage and Part D, is October 15th through December 7th for changes effective in 2026. So, January 1st, 2026. When a plan is discontinued, beneficiaries have special enrollment or guaranteed rights to choose another plan. Beneficiaries have rights and protections, appeals, quality oversight, member resources described in the handbook. So please keep in mind that if you do get calls from randomly overseas telemarketers, call centers, it is actually illegal and uncompliant, and they're not following the rules if you didn't request to get called. Okay, so I know you may be getting calls now, right? they are not compliant. They are those people calling you for Medicare. Um, it's it's not compliant. They're not supposed to do that. So I would just hang up on them because and put them on your do not call list because they are not following the rules. Okay. However, from October 1st to October 14th, you can go over your plans with your agent, but you can't make changes till October 15th. Okay, so keep that in mind as well. What to do now? So, your action steps, definitely review your current plan, what prescriptions you have, what premiums, deductible costs will look like under plan in 2026. You want to compare your alternative plans, especially if you anticipate higher drug costs or your plan is changing or going away. Consider whether you're affected by IRMA and whether any financial planning might help. Use digital tools, go online, get the handbook switched to electronic notices, or also just consult on a trusted source, just like ourselves, Medicare 360. Um, Feel free to give us a call. And so that's it, is in a nutshell. So what I have seen, obviously we can't talk about specific plans, but to kind of give you a synopsis, thing things, well, your health plan may change. There are health insurance companies that are more stable and you won't see a lot of changes. But then you will also have insurance companies that have a little bit of instability. And reason being is because of the Inflation Reduction Act of 2025. Remember how they capped the drugs to $2,000, which is a great thing and eliminated the donut hole. But this really affected the insurance companies because now they're more on the hook on the drug cost, right? Sounds great for seniors, sounds great for those that were in that donut hole, were paying $6,000 to $8,000 in their drug coverage. It is very expensive. But for some that weren't taking prescription drugs, benefits have been decreasing. They're getting more strict if you have a chronic condition. You definitely need to actually, you actually definitely need to, oh my gosh, I lost my frame of thought. Um, Yeah, so for those that don't have that much drugs, weren't paying that much, benefits have been decreasing. The insurance companies are more strict on the chronic conditions and verifying that you have chronic conditions to actually get more benefits in your plan. So, um, here's some questions that listeners definitely have been asking. So I do want to bring that up. What happens if I reach the 2100 cap for the Part D in the middle of the year? Well, you don't have to pay anymore, right? Because the most you would pay on your drugs is 2100, which is awesome. I take insulin. How does the 35 cap work exactly? Any restrictions? So yeah, your insulin's 35 bucks. Just make sure it's in that like preferred list and just make sure that it's covered by your insurance company. If my plan is discontinued, how do I know what to switch and when? So this is a big thing. There are plans that are terminating. So definitely look into your different plan options. I would definitely look at companies that are more stable or here for the long run because there are companies that mid-year just filed for bankruptcy and terminated their plans. The nice thing is that if your plan is discontinued, you do have guaranteed issue to get on a Medicare supplement if you choose to do that, because Medicare supplements do have underwriting and you may not qualify. So this is a way to get into that. But not to fret if your plan is getting to discontinued, contact us, a trusted insurance agent, to go over your changes and what options you have. Okay. So for higher income people, what is IRMA and how it is calculated, how to reduce it? So IRMA is based on your income related monthly adjustment from 2 years ago. So in 2026, they will look at your adjusted gross income for 2024. If you were a widow, sold your home, we could get you that exception. Well, not promising you, but we will help you apply for that appeal with Social Security. If it's just maybe through a layoff, a 401k, a distribution, inheritance, you can still file an appeal, but it's going to be a little bit tougher to get that appeal. How do the digital tools work? Can I really get everything online and skip paper mailings? Yeah, we're getting into that digital age. I mean, I'm a paper person too. I love the paper, like it's just the feel, reading it, signing things, and so forth. But we are in that digital age. You definitely could go on Medicare.gov to look at your plan options. But of course, sometimes when you're reading something and talking to a licensed independent insurance agent, it is very different because we know the ins and outs, we know the vendors of these plans, we know what's going on in the industry versus just reading it on the computer, right? Or on paper. So that is in a nutshell on the Medicare and You handbook. Um, yeah, so like, let me just recap again. Is that you should have got the Medicare New Handbook in the mail for 2026, and they are changes, right? The biggest thing with that would be your deductibles might change, the Part B premium might change, which didn't come out yet. The prescription drug deductible change, the max out of pocket on your prescription drugs changed, right? So that's the 2100 for Part D, deductible for Part D 615, and then the insulin cap is still $35 per month. So the biggest thing on your prescription drugs is that making sure that your drugs are covered, and if you're going to pay for something or if it's going to increase in cost. Some carriers do have a percentage. Some carriers do have like the percentage, meaning like the co-insurance on that, or just a copay, which is a flat amount fee. So just keep that in mind. So for the Medicare Advantage plans, there could be revisions on there, especially for those with special benefits, people with chronic illness, and then just some of the nice to have perks, especially the ones that aren't directly health related, might no longer be offered under like the chronically ill benefit category. So you do want to check your plan for these offerings. Some insurers are pulling out of certain areas or stopping certain plans. So your options will definitely maybe be different in 2026 and in 2025. Like kind of the surpriser to me, some insurance companies are removing their fitness benefits. Um, eye benefits, right? So those are the things to definitely look at. Start budgeting in regards to the Part B expected premium. They say it is going to definitely go up, but we don't know yet until it comes up on that. And then the IRMA surcharges will go up as well. So these changes can affect your monthly budget significantly. So there are some good stuff too, like the preventive screenings and better digital access, managing your prescription drugs, your Medicare summary notices, getting that handbook. So I would really recommend doing the preventive services like cancer screenings, getting it early with these can help catch issues sooner. So don't forget, October 1st to October 14th, you could talk to a licensed insurance agent. The plans will come out. For those that are antsy or want to get it over with, to review their benefits, yes, reviews could happen on October 1st. And then October 15th to December 7th is when you can make a change and enroll in a different plan, change your coverage, switch plans. And definitely, if your plan is discontinued, you usually do get that special enrollment period. So remember, the handbook does walk you through your rights, including appeals, denials, making complaints, so things like that. So, well, what should you do today? I would definitely check your medication list against your current and potential plans, like get your medication list going. Also, when you're talking to a licensed insurance agent, you do need a scope of appointment completed, meaning it basically says that you are okay to talk about these Medicare plans, Advantage, Sub, drug plan. So you are giving that agent permission to talk to you about it. So typically there is a 48-hour waiting period. If you do talk to someone, you need to wait 48 hours, sorry, once you sign that to talk to that person. So keep that in mind. If you don't get that, that agent's really not compliant. Okay. So the bottom line is 2026 does bring some cost increases, but also some protections, especially around prescription drugs, insulin, and vaccines. So if you plan now, you definitely could avoid surprises and get the coverage that works best for you. So remember, um, talk to a licensed insurance agent, sign the scope of appointment that basically states you are allowing permission to go over the plans, get all your prescription drugs done. If you want to change your primary doctor, keep them, all your specialists, and just any type of benefits you need. Typically, seniors really want dental, so there are still good dental plans within these plans. So keep that in mind. But I really recommend that you do go over your plan because you just don't want to have any surprises next year if something particular that you actually use on a daily or monthly basis is going to be gone. So that's my big thing for you guys. Look forward to our next show to go over other things or just maybe deep dive in regards to what to do, what to look for this annual upcoming enrollment period. Once again, my name is Jennifer Lee, your Medicare 360 show host. I look forward to next time. You have a great day.